On Stem Cell Awareness Day, at RegMedNet, we've been looking at some myths and facts in stem cell research. Myth: all stem cells are the same. Fact: this is false. There are many kinds of stem cell which can be grouped by their ability to differentiate into other kinds of cells. They range from totipotent cells, such as those found in a zygote, which can turn into any kind of tissue, to pluripotent cells, multipotent cells, oligopotent cells, and finally unipotent cells, which can only differentiate into a single cell type. Myth: embryos or fetuses are the only source of therapeutic stem cells. Fact: this is false. The most common sources of therapeutic stem cells are currently bone marrow and cord blood, both of which are harvested safely from a donor. Other non-destructive sources of stem cells include amniotic fluid, and organs such as the brain and intestines contain organ-specific stem cells. Myth: you can turn a cell into a stem cell. Fact: this is true. Cells can be induced to become pluripotent stem cells through the introduction of various transcription factors, such as the Yamanaka factors, discovered in 2006, and by using other molecules that mimic the effects of these factors, such as ALK5 and MEK inhibitors and certain recombinant proteins. Myth: administered stem cells will always migrate to the site of injury. Fact: this is false. Although cells naturally found in your body, such as mesenchymal stem cells, often migrate to injury sites in response to biomarkers of inflammation, this process is not well understood. Infused stem cells can have difficulty migrating due to the site of administration, site of injury, and a shorter lifespan. Myth: stem cell therapies are proven to work on everyone. Fact: this is false. Although stem cell therapies have been shown to be highly effective for certain specific indications such as leukemia, these trials usually involve small numbers and they don't work on every patient. Factors such as the source of the stem cells, the age and the health of the patient, the indication, conditioning regime, and genetics could all affect the success of a potential treatment, and we don't yet understand why or how significant the effects could be. Myth: if clinical trials are listed on clinicaltrials.gov, the trial has been approved by the US government. Fact: this is false. The US National Library of Medicine, which provides clinicaltrials.gov, does not verify the scientific validity of any of the 278,000 studies that are listed from over 200 countries. Responsibility for providing this information falls to the trial investigator, so potential patients should be careful and discuss all their options with their healthcare provider before participating. To find out more about any of these myths and facts, visit regmednet.com.